Hello, everyone. Welcome to the second Big Sky virtual town hall. I'm grateful to have you all here joining us. We had a great reception last week. We had over 3,000 people engaged with the town hall and a lot of positive feedback, so we've decided to do it again, and so here we are. My name is Eric Gladden with Outlaw Partners and Explore Big Sky News and Media. And let me go ahead and just get the big question out of the way. Am I wearing flip-flops? And I am. So I was listening to a epidemiologist in Arizona get interviewed about the COVID and his advice on what people should do during this time. And his advice was to air it out. He said, open your doors and windows and let the air inside, and let's start engaging with the warm spring air. And this should help hopefully level the curve around the country and around the world. So I'm wearing the flip-flops to help be a good motivator to let's get this baby warmed up and let's get on to the spring. I am joined today by the managing editor of Outlaw Partners, Joe O'Connor, who's hardly slept the last 3 weeks. He and his team have done a great job covering this. So grateful to have Joe here, and he'll help mediate this today. Moderate. And yeah, so let's take a little 22-day reflection, because about 22 days ago is when this really began in earnest for Big Sky. It was March 15th. It was a Sunday. And it was announced that Big Sky Resort was unfortunately going to have to close. I was up at the resort, and lo and behold, it was a powder day, and it was a sunny powder day. And I got down to Southern Comfort and got on the lift with a really neat family from Tennessee. And they told me how it was their first time ever coming to Montana. And they had 3 kids, and they were beyond excited to come experience Big Sky Resort and all it had to offer. And obviously, they were extremely disappointed with that the resort was going to be closing, and they were only going to get 1 day. It was the start of their spring break. But what was interesting on that chairlift ride is that they quickly shifted from, while they could have been really upset about their vacation being ruined, they immediately shifted to questions about how our community was going to be able to survive this. They said, you're a small community. Is your medical system set up? What about all the workers? What about all the locals? What about all the businesses? So it was really neat to see how that conversation and that short chairlift ride shifted. As we got off the chair, they did promise me that they would come back, and they said they would definitely be back next year, and look forward to having a little bit of revenge and having a great spring break here. So fast forward 3 weeks later, our town's a ghost town. A lot like anywhere else in America, our community is heeded to the request, and everybody's staying at home and businesses shut down, but we are a ghost town, and there's a lot of suffering and anxiety surrounding that. And now this week we're being told that get ready to brace. Could be the biggest week in terms of COVID breakouts around the country. And our job with Explore Big Sky is to keep you educated and be able to address questions about what's going on. So that's why the town hall is being brought to you in this format. And so there'll be a couple different ways that you as listeners and watchers today can engage. If you're on Facebook or you're on Zoom, you can submit questions. Joe O'Connor will be doing a good job looking through those questions, and he'll be trying to bring them in as the speakers come to conclusion of their primary course of being interviewed. And then we'll also do a wrap up. At the very end of this, you're also welcome to submit more questions to us at Outlaw Partners. We will be doing this again next Monday. So if you have any advice for other speakers you'd like to hear from, or other questions that you didn't get answered, please let us know. We'll be happy to address that. So with that being said, let's get after this. We're really blessed to have an incredible group of panelists today. I'll go through and do quick introductions, and then we'll jump right into it. Starting off, bouting in the number 1 position today, we've got Taylor Rose. He's joining us again from the Big Sky Medical Center to address direct questions as to the medical center and what's going on there. So Taylor, thank you for coming back and being here today.
Thank you.
I guess we can jump right into it. Any meaningful updates to really report to the community and since we talked last week in terms of the medical center or the county?
Yeah, right now, just a quick update on the COVID situation that's happening in the state. Montana, as of the latest numbers I saw, had 319 confirmed cases, and Gallatin County had 118 confirmed cases, which kind of just goes to show that we are the hot spot in the state. We're acting as such. We're trying to be extra cautious with social distancing and just taking those extra precautions. The health system is preparing for major surges. We're actively running our incident command and making sure that we are addressing all potential scenarios of what could happen with this pandemic. Currently, there's only 2 hospitalized COVID patients in the county, and so that's the current update of the state of the situation in the county right now. The hospital is currently here in Big Sky Medical Center. We opened a viral triage clinic this week, and that's for any patient that's presenting to the hospital seeking care. They'll be referred to that part of the building where they'll be specifically treated for viral symptoms. That kind of keeps us differentiated between sick and not sick people that are coming to seek care when it comes to the COVID virus. Visitor restrictions do remain in place. We are not allowing visitors except in specific circumstances. And drive-through testing for our COVID is up and running. And if you have an order from a doctor or any kind of provider for a COVID test, you can come through and they'll just take your swab in the car. You don't even have to get out of your car for that. It protects us and it protects you and it protects everybody on the campus. We continue to encourage people to use our drive-through pharmacy. You call ahead and you get your prescriptions delivered to you. We're working hard to increase our capacity in the hospital. We're in a construction project to build out some additional rooms. We're also looking to bring in additional testing capabilities, not only the Big Sky Medical Center, but the entire system. We anticipate that we'll have a new testing machine within the next few weeks on site that we'll be able to test for COVID here locally. So that's currently the situation with COVID here in Big Sky, and yeah.
Well, I appreciate that. That was a very detailed update, so thank you for that. I know that a lot of people keep asking about trying to understand case numbers as it relates to Big Sky versus the county, and obviously the health department is not allowing that. They're keeping everything grouped. I think, is there any indications that you can at least give people from Big Sky to understand, or are we seeing increases in Big Sky, or is there any sort of percentage increase in terms of visits or numbers of tests being done, or anything that you can give someone an indication of what's happening here in Big Sky?
Yeah, as you mentioned, the health department is they're asking that we let them communicate the cases. They do own that part of it from their aspect. So we're letting them communicate where the cases are being done. I will say that we are seeing the normal route that this disease is taking in other locations we're seeing here, where we don't feel overwhelmed right now, but we are preparing for more. So we're seeing more, and as the health department has said, we have community-acquired transmission, which means that it's just in our community now. It's part of the disease, flora and fauna that's out there, and we just want to make sure that we're practicing the social distancing, hand hygiene, really taking serious what the CDC recommends. We want people to be out and about and get the recreation they need, but when you go to trails, make sure to keep those 6 feet social distancing protocols in place and look for less traffic trails and just maintain those distances that they're asking.
Excellent. It looks like, one of probably the best kind of websites that's tracking this is this IHME website in terms of doing nationwide predictions and such. And it seems that Montana so far is kind of trending below where the predictions were. Is there any science that you guys have been able to place to this, or is this kind of following? Are you guys agreeing with what we're seeing, that we seem to be doing a little bit better than what they predicted?
I would hope that we're doing better than predicted. We're hearing that, social distancing is working. Keep doing it. Don't give up now. There's a recommendation from the CDC to wear masks, but that doesn't negate the importance of social distancing. People, when you need to go out, wear the masks but still practice that social distancing. I will say that the system is working actively to estimate and use predictive modeling to really figure out where we're at on the curve. I don't have an answer for you on where we're at on that yet, but we are working to actively understand this at a local level.
Okay. Beyond the social distancing and kind of the standard protocols, do you have any needs or requests of the community at this stage?
No, just follow the guidelines, and if you need help, we're here for you. We want to be here for you. And reach out, call us if you have any questions on if you should or shouldn't come, and we'd be more than happy to direct you.
Excellent. You mentioned a little bit about the room construction. Can you give us an update on that? And then also in regards to the new ventilators that were purchased through that Big Sky Relief program?
Yep. So thank you to the Big Sky Relief and all of our community partners. We've been able to quickly, I've never seen a project go this fast, build out 4 additional inpatient beds. That, to give you an idea, is going to double the capacity of our hospital. Those funds will allow us to do this where we would not have been able to. And we're estimating early May to have those rooms constructed. We need to equip them still, but everything's going on track as it should be, and we're expecting good things from those rooms.
Excellent.
And then the ventilators as well, we're working to get those here on site, and hopefully within the next few weeks, as you understand, the demand for that nationally is pretty high. So we're working hard to get those.
All right. And then in regards to any other PPE equipment, you guys, I mean, do you have what you need right now? Are there any needs out there? Do you need people out there with sewing machines or anything going on?
Yeah. And I'm sure Ben Christensen from Sims will touch on this later if he's able to talk, but we are looking for innovative ways to utilize and reduce PPE and also reach out to our community partners. Sims has been a great partner in that. They've sewn us some gowns that are reusable, that are washable, that are completely in compliance with everything we need from an infection control standpoint. So the community has really stepped up. We've had a lot of people reach out to us, provide us with resources, and we're forwarding that on to our incident command, looking and evaluating on how we can best leverage these resources that are being thrown at us. And we're very grateful to everybody's involvement and support in this. And we're just trying to, arrange it all so it works out and follows the infection prevention protocols that we have.
Excellent. Joe, is anything that has come in or anything you'd like to follow up with before we let Taylor get back to his day job? Looks like Joe might be muted. So,
I got you.
all right.
Yeah.
Hey Taylor, thank you for coming aboard and coming back on to speak with us. I just wanted to ask you, a couple of questions, but first, how's your staff and the doctors holding up?
They're incredibly resilient. We've asked a lot of them through the last few weeks, and a lot of it revolves around training and preparation. Our patient volumes, they're not outrageous. They're relatively low, like as we'd see in any shoulder season. But we've asked a lot of them to learn new processes, change the way they're doing things, and change habits. And, they've been great. They've taken, the call to action, and they've really been doing a lot of hard work to make sure that they're best prepared to address the needs when we do have those COVID patients come in. We're able to care for them, reduce the risk of their transmitting the COVID disease to the healthcare workers here. And just, I can't say enough good things about the frontline workers that you guys have taking care of you. They're about as good as I've ever seen.
Gotcha. Thank you. I got to tell you, Taylor, we've been getting just a number of questions, a lot of calls, a lot of emails, text messages, a lot of people asking this question. I understand, you mentioned Gallatin County Health Department has jurisdiction for positive COVID patients outside Big Sky Medical Center, and is not discussing specific locations of individuals within the county due to HIPAA regulations. Can you touch on some of the reasons, just for the audience and everyone here, of why this info is not being disseminated, and is there a public right to know information about what town cases are located
in? That is a good question and a hard question to ask, because everybody wants to know. Everybody wants to know, are they at risk? And is the person, that I'm interacting with going to give me this disease or, what have you? But I honestly, the health department has their policies and procedures and why they do things. We're just following their recommendations and treating, this situation in the best way possible. I will say that there is community transmission in Big Sky Medical Center, as I said before, which means there's people walking around here that have COVID-19 that will never show up to our facility because they never are sick enough, and you can never know who those people are going to be. So us informing the public of we have this patient or we don't have this patient is not the best use of how to teach people how to live with this in their community. It is here, it's out there. If you treat everybody like they may be a carrier of COVID, you're going to be much better off than knowing if it's your neighbor or not, or if it's, you know, somebody that I don't know. You may get this false sense of security thinking, oh, it's only one person that, you know, is tested positive, or it's 100 people that have tested positive here in Big Sky. You know, there's these false senses of security that can happen because that's only a small percentage of the people that probably actually have the disease and are walking around with it day to day.
Sure. Well, thanks for that. You know, one last question. You know, you mentioned Gallatin County currently having 118 cases. You know, according to the state's response map tracking COVID-19 in Montana, the next highest county in terms of positive cases is Yellowstone with 40. I was just curious, in your opinion, you know, what are some of the reasons that Gallatin County numbers are so much higher compared with the rest of the state?
That is a good question. I am not an epidemiologist or pretend to be, but I think it's kind of the things we already know. You know, we're a touristy county, and there's been a lot of in and out, and it just is. It's in our community. It probably hit here sooner. We have a lot of workers from a lot of different areas. It's just the dynamics of what's going on, and it kind of just goes to show that, you know, the policies out there that got us the tourists that we had, that our community thrives on, there's stuff that comes along with that, and that could be partially to blame for this. So.
Well, look, thanks so much, Taylor. I really appreciate your time. You know, Eric will send it back to you.
Thanks, guys.
Taylor, thank you once again. Please thank the team over there and keep us informed if there are any needs. I know there's a lot of people in Big Sky that are ready to roll up their sleeves and help, and we're grateful for everything the team's doing over there.
Yep, thank you, everyone.
Wonderful. Well, shifting gears, this man does not need any introduction, but he's been in this community for nearly 40 years and has been running Big Sky Resort for many of them. His camera's not working today, so we're going to be improvising a little bit, but we have Taylor Middleton on the line from Big Sky Resort. Taylor, thanks for joining us.
Glad to be here. It's always fun following Taylor Rose because those hospital updates are really important.
Absolutely. Well, I thought, Taylor, because I was privy to you sharing this story with me, and I think it's such an important story for kind of the history of our town and the mountain. Can you describe a little bit to the audience of the phone call that you took at 3 a.m. on the morning of March 15th and kind of the subsequent dominoes that fell from that and kind of the decision-making surrounding that moment?
Yeah. You know, I've taken a lot of 3 a.m. phone calls, but that was the first one I'd ever had of that topic. The Boyne senior team across the nation had been keeping track of what was going on with COVID, and especially in the epicenter at the time, which was Europe. And Austria and Switzerland were in the process of having breakouts and closing down their resorts. And our owner, Stephen Kircher, was in Switzerland that day. And we'd been talking with other community leaders for several days here in Big Sky, assessing the situation and asking questions for which we didn't know the answers, but we were contemplating what might be happening here in the Big Sky community. But at that point, we were contemplating how we could do more social distancing and keep our community open. But then the second shoe dropped, and that was Colorado closing on Saturday. And then the governor of Colorado announced a mandatory closure. And so the Boyne team got together again and started asking the question. And we worked all night and finally decided that that we were going to close down all operations for all Boyne resorts. And we didn't do that because it was a mandate. There was no governmental order. We did it because we were looking at the facts. And we wanted to be on the front end of this thing, of flattening the curve, before that phrase was even a popular phrase. But we didn't make that decision lightly, because we knew the economic consequences it was going to have on these communities that we were working in and partnering with all these businesses and entrepreneurs and employees. So it was, of all the hard decisions that we've made, that was one of the hardest ones. So I crawled out of bed and decided where I was going to start my day. And I was up at the resort by about 4:45, boots on. I didn't take my boots off that day until I think 6:30. So it was a sweaty foot day. I needed flip-flops. But I started my day with ski patrol and started telling the story and talking to guests and talking to employees, and then eventually started talking to business owners in the community, letting them know how sorry I was and we were that we had made this decision, but we knew it was the right decision, but it was a hard decision. Sometimes the right decisions are the hardest ones.
No, absolutely. And I appreciate you sharing that story. That definitely is a little piece of history. That's not something that's happened to you before, and hopefully will never have to happen again. But how is the resort doing? I mean, a very generalized question, but how are you guys doing now through that transition and staff and operations? How would you classify the resort's status of health at this stage?
I mentioned that the Boyne executive team had been talking about this, and the word that we were using before we knew what we were going to do is that we were going to lead whatever we needed to do in an orderly fashion so people could prepare and businesses could prepare, and it went from orderly to disorderly very quickly. And we spent the first 2 weeks trying to take care of people, trying to take care of employees, taking care of businesses, taking care of vendors, making those kind of decisions. Our whole town, we're right in the epicenter of this thing economically, but I'm sure glad that we are not in the epicenter from the standpoint of the virus. All of you have been reading of what happened in Colorado and what happened in Sun Valley, Idaho. And they had very early cases in those places. And then they had mass spreading events going on just because they were early. But Big Sky, we as a community have been very fortunate. We do not, to the best of my knowledge or anybody's knowledge, have mass spreading going on, although we do have community spread, and although we need to be socially distancing and following Taylor Rose's tips, our community's been lucky, and for that we're really proud, and we hope it stays that way. Lucky from the standpoint of health, unlucky from the standpoint of the economy, because it does not fall on deaf ears that this is devastating, and I didn't choose that word lightly for our community economically.
Absolutely. On that note, Taylor, and you guys are obviously the largest employer in town and such. Can you explain how the resort is playing a role in the relief effort and any type of programs that you guys had towards the closing down of the resort, or any plans you've got moving forward in terms of being a player in the relief effort in town with local businesses or employees?
Yeah, it started from the moment we started talking to employees, and we paid seasonal workers, depending on where they were in their pay schedule, a minimum of 7 days up to a couple of weeks, for them to move on to get back home. All of our seasonal workers, we encouraged them to get back to their families or to get back home. And most of them got on planes or got in their cars and started moving out. we house in seasonal workforce housing over 500 employees in Big Sky. We knew that we wanted to thin out that, so although we put a mandatory move-out order in place, we knew that we would need to continue to house some really good workers that did not have places to go. And we still have about 50 to 75 that are here. We had international workers here, and some of them were able to get out immediately. Some of them couldn't get out. Peru and Chile both, it became hard for them to get home. So we housed them and fed them and loved them and made sure that they were being socially distanced. And I'm really happy to report that all of our international workers have now moved on and are on their way home. Of course, we've been staying in touch with the hospital and other community organizations. Of course, we've been working with all of our employees that we have off-boarded and furloughed to help them get their economic house organized for the duration. And the duration of this thing, is it weeks or months? Nobody knows. How long is our community going to be closed? We don't know. Nobody knows the answer to that. But Big Sky Resort, we are taking the long game, like the Kircher family has always taken with Big Sky. And we're thinking about both short-term and long-term ramifications.
Excellent. Well, thank you for having that outlook. Moving towards the summer, you guys recently announced that you are going to be pulling back some of the big capital improvement projects. I mean, can you give us some insight to that decision making and what that will mean for this summer and going into next winter?
Yeah. So we're used to building lifts in one summer, and you don't take out a core lift unless you're absolutely sure that lift can be replaced with something new by opening day. And with disruptions of the supply chain, we just didn't have the confidence that this lift, which we've already purchased and which has already been custom manufactured for us to replace Swift Current, we just didn't have the confidence in the supply chain that we could get it built by Thanksgiving Day. And then with the workplace environment, we weren't sure that even if the lift was completely delivered, if construction at every segment would be able to happen at the speed that it would have to happen, or if the construction workers could work safely. And then finally, of course, going back to what I was talking about a minute ago, and all of you are asking yourselves, is how long does this last? And so many businesses in this community, including ours, our revenue has dropped to zero. And so cash is king, and we're preserving all of our cash as best we can. We're canceling a lot of projects just to keep cash in the bank so we can get through summer. We can get through reopening, and we're also assuming that even when we do get reopened, that the business levels might be kind of soft. So financial planning is key right now for all businesses, and holding back on capital projects is a victim of that.
Absolutely. Can you give us kind of in general what you're hearing across the ski industry and in terms of how the industry is holding up through this, and any forecasting coming into the summer?
Yeah. Well, there's a lot of information out there on what Vail is doing. Vail has canceled all capital projects across their entire network. They've laid off all of their hourly staff, tens of thousands of workers. They're protecting cash. They've quit paying dividends, but they're in it for the long game, right? And they will come out of this thing. Aspen is continuing some capital projects, but they're a very conservative stance, and Mike Kaplan was talking the other day about summer and wondering if they would get open in June or July or not ever in the summer. The bigger resort companies, including Boyne, are blessed from having come out of a few good years consecutively and to be in good cash positions and have good banking relationships. So it's a really bad thing happening at a pretty good time economically. That's what the industry is thinking right now. It's just cinch down and be ready to play when the whistle blows and the game starts again.
Yeah, absolutely. One last question for you, Taylor, and then I'll let Joe bring up a follow-up question. Like I said, you've been in this community for 40 years and you have known and know a lot of the business owners and operators. You've seen a lot of businesses come and go. If you had to give a piece of advice for a small business operator that's sitting in Big Sky today wondering what's going to come and when the lights might turn back on in this town, what advice would you give them?
Yeah, we'll never give up. That's how I've known Martha and Ania, who are both on this call, for years. They are not quitters. I'm not a quitter. You're not a quitter. Don't give up. And hang on to your cash and love your employees and care for them and study these government programs that are out there and don't give up. Don't lose heart. We're going to get through this thing and we're going to get through it together.
Excellent. Great advice. Thank you. Joe, anything from your end?
Well, thanks, Taylor, for joining us on this. You and I had a conversation early in the afternoon on the day that the resort closed. And it was one of the more difficult interviews. It was tough. I know it was a difficult decision for you and the exec team at Boyne to make. And it was a sort of out of the body experience interviewing you for that, knowing just how difficult it was for you and for the entire community of Big Sky. What went through your head? I mean, I know there were a series of talks leading up to those decisions, but, when you had to make that call and, make it swiftly, what went through your head at that time?
Yeah. Given the facts, as hard of a decision as it was an easy decision because it wasn't one of these decisions where we were asking ourselves what the right thing to do was. I had quickly transitioned in my thinking to what does this mean to our employees? What does this mean to our community? How are we going to manage through this thing? So I guess I went into my automatic mode of trying to turn lemons into lemonade, right? And that's probably describes where I am and many of us are today.
Mm-hmm. Well, that positivity is really critical, for everyone in the community to hear, and that's great messaging. One last follow-up, and I don't want to get into too much speculation here. I just was curious if you guys have had these, talks at the executive level at Boyne. There are conversations about the potential of this virus rearing up again in the fall. Are you concerned about this, and are there any precautions or conversations you and the executive team at Boyne are having or talking about in the event that this could happen?
Yeah, that's the question, right, Joe? That's the hard question. Mm-hmm. Well, so the economic restart in this community, in this state, in this nation, in this world isn't going to really happen until there is an effective medical treatment figured out and an effective vaccine invented. Mm-hmm. And we've got brilliant scientists that are working on that now, and tremendous economic resources are being put forward that now. And that has to happen first. And until that happens, it's a very dynamic, fluid situation. We're playing defense right now, but as soon as those medical things that I was just talking about happen, that's when the world can start playing offense again.
Got it. Got it. Thank you very much, Taylor. I appreciate it. And thanks again for joining us today.
My pleasure.
Thank you, Taylor. Once again, to those of you out there listening, sorry for the video problems, but Taylor's very much here. And if you have any questions, you're welcome to submit them and we can ask some follow-up questions at the end. Transitioning over, next up we have Ania Bulis. She's today representing the Moonlight Community Foundation. Ania's been a fabric of this community for over 26 years, and in addition to being one of the leading real estate brokers, she has a passion for a lot of amazing community projects and shows this in a lot of different ways, but right now is here representing the great work that Moonlight Community Foundation is doing. So Ania, thank you for joining us today.
Thanks for doing this, for always doing everything you guys do for the community. It's really impressive what you guys have put together, not just in these town halls, but in general, as you know.
Well, thank you for saying that. I guess jumping right into it, for those in the audience that might not be familiar with Moonlight Community Foundation, maybe give us a high level of what the foundation is and does and is currently involved with.
Sure. So just like the other community foundations, YCCF and Spanish Peaks Community Foundation, Moonlight has their own community as well. And after our strategic planning session last August, we really wanted to dive into 3 areas specifically. We've always been passionate about conservation. Moonlight has a foothold in that arena in Big Sky, but just really has been listening to the land and has been dedicated to stewarding that path. On another note, we've always been heavily involved in children's programming in general with the schools. Sustainability has been another initiative that we've been focusing on. And like all the other community foundations in Big Sky, mental health keeps climbing to the top of that list. And that was certainly one of the outcomes of our strategic session last fall.
So jumping into that, mental health was brought up a lot in the last couple of weeks, especially since this shutdown, and has become one of, I know, the hot topics, not only on a nationwide basis, but especially in a ski town. So what updates can you give us regarding, progress being made on the mental health front in Big Sky and projects that you guys are involved with?
Yeah, so we had been having a lot of conversations around mental health, starting really more seriously in the fall when we met with Buzz Davis, who, for those of you listening who don't know Buzz, he put together a phenomenal report that took him a year to collect data on Big Sky, on all types of behavioral health, from depression to substance abuse to suicide, really the wide breadth. And so in meeting with him repeatedly and then with other community members, we were already going down the path of how do we tackle this enormous problem that exists in every community, but especially is prevalent in ski towns. And then COVID-19 happened. And so the unprecedented scenario in which we found ourselves was one in which we felt like we needed to act really swiftly. And it was really with the help of so many different efforts, so many different individuals. And, Bozeman Health stepped up, Women in Action has stepped up, and they've been consistent in terms of providing counseling in the area. BSCO, the hours that those individuals have put into this effort is incredible. And then just community members at large all came together to provide as many resources as could be made possible in as quick and short a time as possible.
That's great. Can you give us some specifics on a couple of the programs that have been rolled out?
Sure. Probably, I would say there's 3 critical ones. One is there's a 211 number. So for non-emergency issues, if you're feeling like you just need somebody to talk to, and you are feeling anxiety, you're feeling depressed, you should call 211. That is a 24-hour hotline put out by the Help Center, and they will put you in touch with the correct entity. So that is a great number for all of us to remember and put out into the community. Additionally, and that is free. So these are free services that I'm talking about now. Additionally, Women in Action has hired a new counselor. Also, all of her hours will be free, at least for the next month, if not moving forward from there. Thirdly, we are doing some virtual meetings. So as many of us know, when you go into social distancing, one of the first things that happens is you can feel emotionally lost and disconnected. And so what we're trying to do is provide avenues of connection for children, for adolescents, for parents, for senior citizens in the area. So there's a vehicle out there that's now going to be programmed, if you will, with various hours of the day to allow people to go in and have a virtual book club or a painting class or a dance class or a cooking class, different avenues for people to just connect with one another.
Excellent. Since you touched on it a little bit, and I know the representatives aren't here that run it day to day, but maybe give a little bit of insight to Women in Action and that group. They do such phenomenal work, and I think sometimes are kind of unsung heroes in this town.
Yeah, I mean, it was really like a little bit of a grassroots effort long ago, and now they are an organization in Big Sky that people can go to get free or discounted mental health counseling. And one of the things that we've known as citizens here is that often their counselors are booked. And one of the things that I believe Buzz's reports showed was that there was a 9-month waiting list for the counselors that they currently had. And so it is that constant attempt, by them to get more and more counselors into the area. I think we're going to see some shifts in general. We have not done a lot of telehealth in Big Sky, but again, because of the COVID-19 and because of the social disciplining, because of the social distancing that's in effect, we're going to see more telehealth, and that could actually open up more opportunities for people to get the kind of guidance they need.
Excellent. Well, they do great work. Before I hand it over to Joe to see if there's any follow-up questions, I guess, if people want to get involved in support, Ania, what are ways that people can get involved?
So there's a lot of different initiatives out there right now. In terms of supporting mental health in general, you can donate to, right now, 4 organizations and specify mental health. So if you're part of one of the community foundations, it's really easy to go on any of their website, donate to them, and just simply specify that you'd like to have that donation provided directly towards mental health services in Big Sky. Another option is obviously donating through Women in Action. I think ultimately the goal is for all of us to put together a collective behavioral health platform in Big Sky. And if anything, if there's a silver lining in all of this, is that it's really put it at the forefront. And so hopefully that planning will be expedited, but that will include Bozeman Health, it will include Women in Action, it will likely include BSCO. From a financial front, that's one way to help. I would say there's probably 2 other easy ways to help. BSCO has a fabulous list of volunteers. There's a lot of people out there who could use help with grocery deliveries or mail deliveries, or even just a phone call or a FaceTime call will make their day. And so BSCO is taking names of volunteers who are willing to do that and pairing them with others who may be in need of those services. And then lastly, I think I mentioned the virtual gatherings that we're going to be having. If you have something to offer, I mean, it could be a knitting class and there might only be 5 people that are interested, but you're providing something real for those 5 people during a time where they might not have much to look forward to. So that's another option. And that is also being scheduled through BSCO.
Okay, excellent. Well, thank you for that. Joe, anything from your end?
Sure thing. Ania, thanks so much for talking with us today. You mentioned that Moonlight Community Foundation is working on children's programming in the community. With distance learning being the new norm for kids right now, what are some of the issues you all are seeing in our youth, and what steps are being taken to mitigate some of these concerns?
So we have in the past done a lot of funding for youth programming, either by, anything from funding Art Splot in the schools to library initiatives. Currently, we have not yet been approached for any of that programming, but it sits heavily actually on my heart because we're asking our children to social distance, right? So I'm watching my kids not play with other kids for 3, 4, 5, who knows how many weeks moving forward, and what kind of emotional impacts is that going to have on them? I don't know. This is not my area of specialty.
Mhm.
I will say that right off the bat, and I would put the question out to anybody who's listening is, if there are ways that we can be supportive and more and supporting in programming, please let us know.
Definitely. Thanks for that. One final follow-up. You mentioned Buzz Davis and his recently released findings from his year-long study of mental health needs in Big Sky. And you talked about a shortage of counselors in the area. What were some of the main issues Buzz and other entities have identified in Big Sky? And what efforts are being put into place to collaborate with him and other groups on those findings?
Well, it's a really detailed report. And so, but I would say some of the bigger things that stood out to me was the percentage of individuals, at least that were polled, that showed signs of not just exhibited signs, but raised their hands and said, I actually have depression. It was, I don't want to misquote, but I think it was 36%, which seems like a very high number in a community, in any community. The other thing that showed in the report was that there were very few counselors per capita. When you looked at other resort towns, we had a very distinct shortage of counselors in the area. And Big Sky is tough because a lot of the counselors that you're getting are coming from Bozeman. There aren't many, if any, really living in Big Sky. I do know that we have a new counselor in Big Sky who is getting her Montana license, so she'll start practicing in Big Sky hopefully in this next year or so. But I think that's been a real shortage. And so how to address that, how to create really easy navigation tools. He made a comment that always stuck with me from the beginning. He said, we need somebody that's like an air traffic controller, right? And that traffic controller, when somebody calls and says, I have a substance abuse problem, I have a mental health problem, I'm depressed, I'm suicidal, I have an eating disorder, that one traffic controller can actually point that person in the right direction. And, in everything that I've heard from him and read, that would be the most important thing I think Big Sky could use moving into the future. And then coordinating amongst all the entities that exist to facilitate.
Mm-hmm, absolutely. Well, look, thanks for that. Ania, I think, and a lot of people, organizations have confirmed this, that, as we move past, these initial stages of this pandemic, mental health is going to be something that could be a significantly longer lasting issue. So the work you guys are doing, Buzz is doing, so important. So thanks for taking the time. Thanks for doing the work.
Thanks, Joe.
Mm-hmm.
Excellent. Yeah, thank you, Ania, and thank you to the Moonlight Community Foundation and the members up there for their generosity in Big Sky. Moving on to the next panelist, we are lucky to have him here, the VP of Operations from SIMS, the place that I know all of us wish we had Proforms at. Representing today, Ben. We have Ben Christensen from SIMS. Thank you for joining us, Ben.
Yeah, you bet. Happy to be here.
So this is a fascinating story and has made nationwide news pretty quick. And I'm just so grateful that you were able to join us here today to talk about the pivot, that famous word that businesses have to make when times get interesting. But SIMS had a moment of pivot, and maybe I'll let you take it from there and talk about how you guys have risen to the occasion.
Yeah, you bet. So we, in conversation with Bozeman Health, the hospital in Bozeman, realized that they, like many hospitals in the country, were anticipating a severe shortage of PPE, protective equipment for their healthcare professionals. And right about that same time, we were anticipating a pretty severe slowdown in our business and a government mandated shutdown of our wader production. And, the stars really aligned. We saw an opportunity to take our capabilities of making really technical, really durable outerwear and pivot those capabilities to support our local healthcare system in their time of need. So we started with Bozeman, partnered very closely with their team to create a gown that satisfied their functional requirements and utilized materials and capabilities that we had on hand. And with that proof of concept, we were able to produce, I think about 350 gowns for Bozeman Health. We are now producing gowns for Billings Clinic, for the Sydney Health Group, for the Mariah's Health Systems in Shelby, and really doing everything we can to support the community here in Montana, first and foremost, and see where it goes from there.
Oh, that's excellent. As you hear about all this stuff being used up so quickly, two things come to mind. Obviously, the safety of our medical professionals, but also just the waste of how much of this stuff's getting thrown away. So what makes a gown reusable versus what's being thrown out?
Yeah, a lot of the protective equipment is just single-use disposable. So certainly surgical masks, other types of face masks, and gowns as well, particularly for less protective, what are called level 1, level 2 isolation gowns. Our gowns are just kind of by definition reusable because that's the only way we know how to manufacture product, and those are the types of materials that we use in manufacturing. So we're using technical, waterproof, breathable fabrics similar to what you'd find in a really nice ski shell or any sort of outerwear. And those materials are designed to perform over many wash cycles over a long period of time. And so just kind of by design and because of the nature of the materials, these are reusable products.
Wow. So you've already gone past the Bozeman market. You said you're working with a couple other health groups. Is this something that you see further expansion on? And do you see this as something maybe is in a permanent product line moving forward?
Certainly something we hope to expand on. We were cautious about broadcasting our efforts until we had really delivered product to our hospital in Bozeman. But on Friday, we made the first delivery, and Bozeman Health wanted to tell the story a little bit. We put something up on our Instagram feed, and we had, I think, over 1,000 comments within the first 24 hours. Many comments from people who are in the healthcare industry who are looking for protective gowns. And this morning, we were just inundated with requests to get gowns from SIMS. So we are rapidly building out the operational capabilities to efficiently meet all of these demands. I have a theory, which may prove itself out, that smaller clinics, smaller healthcare systems are going to be most underserved as these PPE manufacturers ramp up. I expect that the big manufacturers will target big buyers, big hospital systems. And so I'm hopeful that SIMS can build capabilities that enable us to ship 1 gown, 5 gowns, 50 gowns, whatever's needed out there. So that was my day to day, was just figuring out how we take all of this energy and turn it into as much impact as SIMS can have on this problem.
Well, that's great. And I think when the dust settles, it'll be interesting to think about the amount of waste that was created, not waste, but disposable. And I think what 1 gown maybe represents, that's very impressive. You guys are a cornerstone of the Gallatin Valley. And I will say that we're very proud to have SIMS be in our backyard. Great company, represents great brands and great people that work there. How did you guys take this crisis and pandemic? And I mean, how are you guys doing as a company outside of this gown manufacturing? And how are you guys looking to move forward as we come into your season, into the spring and summer?
Yeah, you bet. Most simply, we are preparing for the worst and hoping for the best. We saw the impacts of this first on the supply side we manufacture a lot of product in Bozeman, but we also source a lot of product from overseas. And so we had the early impact of supply chain disruption in Asia. And of course, pretty quickly saw that impact cross borders and start to impact the economies in Europe and the United States, and very quickly became a demand issue for us, and I think for all consumer brands. Taylor hit on it earlier. Cash is king in a time like this, and so we are just sitting down thinking about the things that we really need to invest in right now to ensure that the momentum that we have as a brand continues through this, and that as we recover quickly. But we're being cautious and we're pulling back a little bit in terms of some of the investments that we had planned. Just trying to shift more and more focus to some of the things that have already been brought up here in terms of how the coronavirus is impacting people's mental health, and really thinking hard about how our employees are transitioning to a work from home environment, making sure that they feel informed and supported. So that's a big part of it as well.
Excellent. Well, that's great to hear. Before I turn it over to Joe, I think, my last question is for all the Sims fans out there, or especially Sims fans that are doctors. Can you get your hands on these gowns? And also, is there a way that as a community or foundations, are you guys looking for support? Are there ways that if there was a philanthropic person watching this that maybe wanted to buy some of these to donate them to a hospital or one of those small, medical practices that's in an underserved area, is there opportunity to do something like that?
Yes. Yeah, definitely. All of that's possible. So we've created an email address, medicalgowns@simsfishing.com. It's just a kind of a catch-all for all of these inquiries. We are, as I mentioned earlier, building the capabilities to ship single gowns or just a couple of gowns to folks that need them. And we've seen a lot of interest in that. At this point in time, the capacity that we have is really fully consumed this week, but we're hopeful that by next week, we'll be in a position to fulfill more and more of those needs. In terms of philanthropic partners, we are absolutely interested in engaging in those conversations. Some of our fabric vendors, some of the manufacturers that we work with are starting to donate goods so that we can pass those savings along to medical professionals. Ultimately, our goal as a business is to cover our costs. We cannot lose money on something like this, just given all of the challenges that we face as a business. But by no means is this a profitable initiative for Sims. We want to deliver really high quality product at a very reasonable price. And anybody who wants to help us reduce those prices, reduce those costs, we would really welcome that partnership.
Wonderful. That's great to hear. Well, I know Facebook's blowing up with comments and questions about Sims, so I'll let Joe maybe hit on a couple of those.
Yeah, absolutely. Thanks, Eric, and thanks, Ben, for joining us today. Just wanted to say, congratulations on the production of these hospital gowns. It's really incredible to see, the ingenuity from your company and many others as they make these pivots in uncertain times. As Eric mentioned, we're getting dozens of thank yous for Sims and the efforts you guys are making on our Facebook Live feed right now. And so, again, it's very much appreciated, and it's really, really cool what you guys are doing. I was just curious, what were some of the challenges that you faced in making this pivot, or was it a natural fit?
One of my initial concerns was our inexperience producing FDA certified medical devices. I was concerned about the compliance side of this. But we pretty quickly determined that we could create gowns that had the functional attributes that medical professionals need, and that hospitals and doctors right now are much less concerned about FDA compliance for this type of product. So we pretty quickly determined that compliance should not be an insurmountable hurdle. It's just something we need to be extremely transparent about with everybody who's involved in this. So the next hurdle after that was just figuring out how to translate our capabilities into a product that we'd never made before, and for which it was really difficult to get samples. You know, anybody who has gowns right now is really hesitant to give them up so that we could go through and kind of break them down and figure out how to reverse engineer and rebuild. But we have a super talented team, Katie Taylor, Clay Kroll, Robert Gibson. These are folks that are apparel designers and fit experts and manufacturing experts. And they got really excited about this problem, and it was all hands on deck for several days until we delivered a prototype to Bozeman Deaconess. Went through a couple of rounds of iteration with them, and ultimately landed on a product that seems to work. So that's where we're going, building off of that sort of initial proof of concept.
Got it. Oh, that's amazing. Well, I was curious, what kind of production numbers are you guys able to produce? At this stage?
Yeah, we're somewhat limited by a couple of factors. So one is that these gowns are 100% sewing, whereas a waiter has a lot of pressing and other types of manufacturing in terms of like making the stocking feet. So we don't have the ability to bring all of our workers back because not all of our workers are sewing specific experts. So that's one constraint. The other constraint is we just need to keep people distant within the manufacturing environment to ensure that everybody's safe. And so as we spread machines and folks out throughout our facility, we're just limited in terms of the number of people that can be there. Having said that, we expect that we'll produce about 1,000 gowns this week, roughly 1,500 gowns next week, ramping up to 2,000 gowns per week for the foreseeable future. And certainly seeking ways to go above and beyond that. But right now, we think we can get to 2,000 gowns per week.
That's incredible. That is really impressive stuff, Ben. Thank you so much. Really appreciate you guys, what you're doing, and thanks for joining us.
Yeah, thank you for having me.
Ben, I did get one last question in. Can fish catch COVID?
I heard that a tiger in New York got COVID. That was just on the news. So, I mean, I'm no expert, but fingers crossed. They're socially distant underwater. Hopefully that helps.
Yeah, no, absolutely. Well, thank you once again. I'm a fan for life. So go Sims.
Yeah, thank you.
All right. Our last panelist doesn't need much introduction. Her and her family have been part of this community for over 30 years. Grateful to have her join us today. We have Martha Johnson, one of the founding brokers of Big Sky Real Estate Company. Martha, thank you for joining us today.
Blythe.
Wonderful. Awesome. So we thought, Martha, we'd bring you on for really to talk primarily about real estate. The biggest investment usually anyone ever makes in their life is real estate. And there's not a person out there right now who's thinking about how is COVID and this pandemic going to affect the real estate market. So while it's probably a little too early to tell, I thought, we're almost 30 days into this. And obviously this trend has been going on around the world for a little bit longer than that, is we would start to open up that conversation for our listeners on what's happening in the real estate market. So if we were to sum it up right now, primarily since Big Sky shut down, how has the real estate market been doing and faring thus far?
It's been interesting. I think the first week after the resort shut down, abruptly ended our season, being about, I think, as you mentioned, 22 days into this. We were lucky enough to be primarily through our winter season. We arguably had about 30 days left of the ski season. I think real estate as well as restaurants and businesses are all grateful that we had the majority of the winter. There was a panic, a lot of phone calls and collaboration, just talking out different situations and circumstances in the first week. We saw about 19 transactions in the month of March terminate, compared to about 6 the previous year in the month of March. But then on the flip side, I think our team has had really meaningful conversations with our clients. Life has slowed down for everybody. People have stepped back from watching the minute by minute stock market going off a cliff, and really started to look at what's big picture and the best family quality for them in their next stages, and having really meaningful and detailed conversations with us as their real estate advisors on how to make this purchase a reality. Silver lining is that interest rates are incredibly attractive, and banks have money to loan, which is very different than the economic downturn. And so I'm starting to see, and I think as a team, we're starting to see our clients really look at what their life, what they want it to look and feel like, how they want to interact from this time going forward. And all of us in Big Sky represent a lifestyle that's very attractive to a lot of people. And so we're doing a lot of hand-holding.
Right.
We're offering resources to clients.
Absolutely.
As far as stats, it's really interesting. We pulled some MLS stats from January 1 to March 31st, 2019. We did 75 units to the tune of about 65 million. And in 2020, January 1 to March 31st, we've done relatively the same, 76 closings, but we've had about a 37% increase in sales dollar volume.
Sure. Well, that's interesting. And I know that, and you touched on it a little bit, that one of the saving graces that we have with this real estate market is we did enter it with very strong fundamentals in terms of low interest rates, low inventory rates, relatively low, debt that was taken out on a lot of purchases, and less speculators as we saw in the 08. So maybe just touch on that for people to understand maybe why we won't see as strong of correction as we did in the 08 recession.
Well, just looking in Big Sky at the infrastructure we have in place, in 08, the ski mountain was an entirely different place. What Big Sky Resort has done with our lift infrastructure, our food and beverage amenities, expanding terrain is really incredible. We have more bars, restaurants, shops, hardware stores, grocery stores. We have a hospital. We have a high school. These are things not too in the distant past we just didn't have as a community. So these resources have really created a foundation, a strong foundation of support moving forward.
Absolutely. You obviously are very involved with some of the larger projects in Big Sky, including Spanish Peaks, which is home to the Montage, which is a massive project for this region and for the state. What can you tell people about where Spanish Peaks in particular stands with all these big construction projects that were going on? And there was a tremendous amount of vertical construction happening there.
It's still going forward. The teams are being very cautious and practicing a safe health work environment with CDC guidelines. But these projects are moving forward. I think globally, we all hope that this is behind us as quickly as possible, and resources are wide open to try and find ways to get through this as quickly as possible. But in the meantime, these projects are moving forward with anticipation of recovery in the near future, and just being as cautious and healthy as possible.
Okay. I'm gonna put you on the spot. I'll say if you could answer it in one sentence for each of these. If I was a buyer of real estate today, what advice would you give me?
As a buyer of real estate, interest rates are low. Keep your money. Go to the banks, borrow money at incredibly attractive rates. You can still write off your interest. And our lifestyle is beautiful, and our community together. I always use the analogy of a samurai sword. Together, we are all going through this fire together, and hopefully we come out on the other side stronger and sharper. But it's a low for a seller, it's a very low inventory. As a buyer, get in the market.
All right. And so I guess the converse is, if I'm a seller and I'm walking into your office today and saying, now what advice are you giving me
As a seller,
as a seller?
we have very limited inventory. We would welcome the opportunity to strategize with you on your timing of bringing your product to market. And right now in real estate, we're sharpening the tools in our toolbox with photography, stronger and more details on every property. We're learning new resources, how to communicate virtually, and who knows, as buyers and sellers navigate this new normal of virtual communication, we may be even busier.
Yeah. Martha, your family, as I opened with, have been a part of this community for a long time, and brothers and other family members own a variety of different types of businesses in town. How's everybody doing? I mean, how are their businesses faring, and anything kind of interesting that you would like to share in regard to that landscape of your family's investments and businesses in town?
Well, thankfully, our family's tight. We're all healthy. We stay in touch with each other regularly, but it's mixed blessings. Everyone's cash flow has stopped, and we earn our living here in Big Sky and reinvest those dollars that we make in Big Sky back into the businesses. My brother with Grizzly Outfitters, along with a lot of company in retail and food and beverage, they're really nervous. They're getting very creative in how to rebound back from this. And I know that they're talking to their collective communities to figure out how to, again, with social media and websites, and how to not go under from an impact like this. As far as our commercial projects, we're cautiously optimistic. We're we're trying to keep our powder dry, if you will, but also strategically keep moving forward, because our projects are more geared towards the support of the community, primarily in community housing, employee housing.
Sure, absolutely. Well, thank you for that. Before I go over to Joe, I guess last question is, you also play an integral role with another great foundation in town, the Spanish Peaks Community Foundation. I mean, maybe just touch a little bit about maybe some of the highlights of any projects that you guys are focused on with the Spanish Peaks Foundation.
Oh my gosh. I'm honored to be on that board, and the collaboration, part of what the silver lining is for all of this is the collaboration with all of the volunteer foundations in Big Sky, and how we're all pooling all of our financial resources and working together. The Big Sky Emergency Relief Fund is something that all the foundations are participating in, the chamber's participating in it, to make sure that our community is really our family. This is still a one-horse town. You come in, you go to the grocery store more than 2 or 3 times, and everyone knows your name and what you like. And it's there's a great old Indian saying that he who climbs highest lifts as he climbs. And so together with these opportunities, no matter who you are in the community or what your need is, whether you're a business or an individual suffering, we have resources for you, and we're doing everything we can to be able to process requests and get them out the door as quickly as possible.
Excellent. Well, thank you for that. And like I said, Spanish Peaks Community Foundation, they were an integral part of that Big Sky Relief founding capital. So thanks for that. Joe, any follow-up kind of regarding real estate and everyone's big investment?
Yeah, absolutely. Well, again, Martha, thanks for, the words to the community, the words from a community member. I think those are really important for everybody to hear right now. there's lots of talk nationwide about the situation from COVID after we start to bounce back from this thing. Any idea sort of what you would say that the Big Sky market looks like in 6 months to a year?
I think it's a little early to make predictions. We're a destination resort, and our airlines really need to support our Bozeman as a route and get their profitability back in line. I think once they've fully recovered, Big Sky will fully recover. On the flip side, I think with gas and oil prices so low, our drive-in traffic, once the shelter in place is removed, could be really strong. And I think that will help the retail, the hotels, the food and beverage immensely to have our drive-in market back. Fundamentals, Yellowstone Park, right next door to us, Big Sky Resort, our golf courses, our hiking, fly fishing waters, our natural beauty really is the most exceptional in the lower 48.
Yeah, no, it absolutely is, and yeah, we're all in this together, so we'll see how it goes. But really appreciate your time today. Thank you very much for joining us.
Thank you for the opportunity and the connectivity to the community.
All righty, so that kind of rounds up going through the panelists. Now what we're going to do is just take a quick minute to see if there's any outstanding questions from you all, and then we'll bring a nice conclusion to this. So Joe, anything from your end that kind of stood out that you'd like to bring a panelist back on to discuss?
Well, I think every community across the nation, across the world is having their own specific, concerns. They have their own specific hopes. I'd like to just kind of ask each of you just briefly, on both of those fronts, what is your greatest concern for Big Sky moving forward with COVID-19? And then, what is your greatest hope you'd like to see come out of this pandemic in the back end? Maybe, we could start with Ania.
So I think I just unmuted myself. Okay, there we go. My greatest concern is probably the longer term effects, not so much the long-term economic effects, because to some extent I agree with Martha, just what I'm hearing from my friends in metropolitan cities. I think after COVID-19, we're not going to go back to a new normal. We are going to see people looking for places where they can still homeschool their children and where they can work at a distance. And it's not going to be because of fear from COVID-19. I actually just think that patterns are going to change. Our society is going to change. And so are we prepared for that? In terms of the amenities that we have in mind, or the everything from the school to the hospital, as Big Sky continues to grow. And I think my biggest hope is that the lessons that we're learning these last few weeks, these last few months, I hope they stick with us. I hope they change us. I hope they make us better. Because we have an opportunity to sort of redesign things within our community, as all communities do across the country, as they do across the world. And my hope is that we just don't go back to what we were doing before, but that the new normal actually has the ability to make us better together, stronger, and kinder.
Yeah, absolutely. No, well said. Taylor, Middleton, are you still there?
Yeah, hi. I cannot, Ania nailed the last question. The first question, I fear this thing would go on too long. If we can be done with this by the early summer, yay. If it lasts longer than early summer, That's the problem.
Yeah. Yeah, understood. No, that would definitely be what no one's hoping for. Ben Christensen, you with us? He might not be with us. Yeah, Martha, just quickly, if you could share, your thoughts on that.
The frenetic pace that we've all, that those of us who live and work in this community tend to lead, is something that I hope we don't go back to. The old adage, take a little time to smell the roses. I really hope that we can slow it down a bit. And because I've just conversations with other families all across the country and world, once the initial fear dissipated a bit and the severity of the situation set in, but their children were home. They were figuring out to get into a homeschool routine, and add a little humor to your day-to-day life. I think it's been a gift. And I agree with Ania in the fact that I hope we can remember this. The conversations have just been wonderful. More about people's lives and goals, and people are really opening up and sharing more details than just checking off the financing box conversation that we typically have in real estate.
Mm-hmm.
And I've really enjoyed that. I've really enjoyed the connectivity to clients, to our community, having the ability to take a 2-hour hike with my kids and dogs, or snowshoe out the back door has really been beautiful and personally good for my soul. My fear is that this goes on too long, and our community is made up of entrepreneurs, mom and pop shops, and I fear they won't be able to hang on.
Well, we're hoping that they can, and I'm sure all of them will. I think there's a resilience in this town that I've noticed, and you all sort of touched on that. At EBS, we've received a tremendous amount of support recently from the community about our coverage, and we're chasing all the leads we can. We're making every effort to bring all of you, timely and accurate news. Big Sky can, like many places, be a rumor mill on occasion. So we're chasing everything and making sure we're doing our job. But send us leads and write us letters, letters to the editor. We want to hear from you. It's our job to inform you all the best we can. I just wanted to say I have an awesome team at EBS. They are really stepping up and putting the work in, and it's a lot of long hours, but we are happy to do it, and we really appreciate everyone's support. So, let's be strong, be caring, be humble, and be patient. And thank you all for your support.
Awesome, Joe. Well, thank you everyone once again. To bring some summary to this, as I go through this great group of panelists today that I'm very grateful for, starting with Taylor Rose, I think he reiterated a similar point that he did last week, that the medical center so far has things well under control. Everyone just needs to continue to heed the advice of giving some social distancing out there. They have great resources set up in Big Sky to help you out. There's been a tremendous amount of community effort in helping the hospital get additional resources, everything from new rooms to new ventilators. But thus far, so good. The numbers have been very much manageable. They don't have any hospitalized patients in Big Sky. There is community spread in Big Sky. So while a lot of you are looking for those exact numbers, the best answer you're going to get at this stage is that just assume that there's community spread, and you all need to practice good hygiene, take care of yourselves, and keep the fear under control that, this is just running its normal course, and that things are happening kind of as they expected them to, but they're well prepared. Moving on to Taylor Middleton, I think Taylor gave us a little bit of history that we'll remember for a lot of years. A very difficult 3 a.m. phone call about how the resort had to make the decision to close. But because the Kirchers have always run a tight ship, and will continue to do so. That the resort is making smart decisions to shore up their cast position to make sure that when it's time to turn the lights back on, the resort will be ready. And they have done a good job taking care of their team and will be there to service all of us as we get our passes for next season. And we're anxious to get back out there and enjoy that incredible mountain. Moving on to Ania, she gave some great insight to what another one of the foundations is doing. Obviously, shifting and pivoting to mental health is critical. Buzz Davis has done some tremendous amount of research in terms of what's happening in our community, and we need to pay attention to that. And the foundations have stepped up, and the medical center has also stepped up. There are resources out there. If you need help, you are not alone. Anything from mental health, from anything small, being lonely, to emergency situations. Remember the 211 number, and remember that there is resources there. Money is not an object right now. There is no reason to have that as a hurdle. And then there's also great community groups that are being created in combination with Women in Action, as well as the Big Sky Community Organization. So if you'd like to get involved in that, please reach out, and there are ways to become part of the community and helping others or helping yourself. Moving on to Sims and Ben's presentation, the word pivot just comes to mind, and that group has done a great job doing so. And what an amazing company and resource to have down the road, and how they've created these gowns, not only to help our medical professionals, but to help eliminate waste. And I'd like to challenge our listeners, because I know there's someone out there listening that is wondering how to get involved, that has a couple extra bucks laying around. How about we throw some money that way to help sponsor some gowns that go to some hospitals that can't afford to buy them? I think that'd be a really cool phone call tomorrow if Ben got it, and we could help underwrite a bunch of gowns to go to some underserved hospitals. And then finishing out with Martha, I think great insight to the real estate market. While it's a little too early to tell, we did come in with extremely strong fundamentals, low interest rates, low inventory, very strong demand for people wanting to be in Big Sky. People need to be diligent. We don't know how long this is going to last. Sellers need to price to the market. If you're a seller right now, it's a tough time, but the inventory is low, and that does play to your favor. And if you're a buyer, Big Sky's the long game. You're not buying for short-term, gains. Buy because you want this as a lifestyle. So I'll finish the way I started, and I'll go back to the metaphor of my flip-flop. And the old Dr. Moore down in Page, Arizona, who's working in an ER servicing an underserved Indian reservation, and they're getting crushed by this COVID situation. And his advice to a lot of people is to open those doors and windows up and let the fresh air in. Now's the time to welcome spring for two reasons. One is I think the fresh air is medically going to help us out in spreading, getting a lot of fresh air into the system, but also spring is a time of rebirth and starting over. And I think that's what's going to happen here. And I think let's all use this flip-flop metaphor to move forward as we enter into the warmer weather and welcome spring. So once again, I'm very grateful for all the panelists taking time out of your day, for all the listeners and people who watch this out there. Thank you. Please share this and get inspired. Share an idea with us. Go out and have some action. We're looking for great story ideas for the paper. And if you've got any idea for panelists next week, or you'd like to be one, please reach out. So have a good night, everyone. Thank you once again. Grateful for you all. Take care.